BBC Sounds. Music, radio, podcasts.
Well, Dr. Aseem Malhotra is with us tonight. Aseem, good evening.
Good evening, Stephen.
So how big a risk is obesity in all of this?
It's a huge risk, Stephen. Just today, it was reported in the Sunday Express that the Centers of Disease Control have identified that if you're under 50, by far the biggest risk factor for death from COVID-19 is obesity, specifically having a body mass index over 30. But I've actually been looking at this data for some time, and I published an article of my analysis in European Scientist on Friday. And what I found is it goes way beyond obesity. Essentially, all of the conditions we call part of the metabolic syndrome, specifically conditions such as type 2 diabetes, high blood pressure, all linked to heart disease. And of course, my speciality is cardiology. All of these are linked to poor diet. And the increased mortality, if you have what we call a cluster of these conditions, metabolic syndrome, from COVID-19 is tenfold higher. So it is the major issue. Now, if you dive further down, Stephen, into what can we do about this, what's at the root of it all, it is poor diet. And what I would be calling on the government to do, what I'd be calling on Public Health England to do, and in fact, I think if they don't do this, I actually consider it an act of negligence and ignorance, is that this is the time now to be telling the public to change their diet. And the reason for that, Stephen,
hold on a second.
Yeah.
And I would say this because I'm fat, but BMI over 30, that's not really fat. BMI over 30 is not really bad. I know it's not perfect, but there's a large proportion of the population with a BMI over 30, Dr. Malhotra.
Yeah, Stephen, you're right. In fact, in the sense that there is a large proportion. Unfortunately, both in the UK and the US, more than 60% of the adult population now overweight or obese. And overweight specifically, for your listeners, is if you have a BMI between 25 and 30, is classified as obese if it's over 30. But actually, what I would argue, what the literature, what the data tells us, what I've published on, what I've researched on, is actually everybody is vulnerable to what we call diet-related disease that puts them at risk of complications from COVID-19. So, for example, in America, and our data specifically is not, we don't have that data specifically here, but it's very likely to be similar. Only 1 in 8 adults over the age of 20 are what we call metabolically healthy. So people, even with a normal body mass index, will have problems of metabolic disease because body mass index does miss a lot of people who will have excess body fat that's going to cause them harm to their health. Now, the good news, Stephen, the positive news here, and this is something I talk about from the research, but also experience with my own patients. And I see many patients who have weight-related problems, is that if you change your diet, and I'll give you more specifics in a second, you can send a lot of these conditions, high blood pressure, type 2 diabetes, into remission, or you can reduce certainly the need for medications within a few weeks of changing diet. Now, on a population level, Stephen, the big issue we have in the UK and in many of these Western countries is our consumption of ultra-processed food, which is now more than half of the British diet, more than half of the calories we consume are ultra-processed, the most processed foods. How is that defined? How do I speak
What do you
to my
mean by an
patients?
ultra-processed food? What is that? Give me an example.
Absolutely, good question. So in general, the definition is usually mass-packaged foods, usually full of additives, preservatives, unhealthy fats from what we call industrial seed oils, sugar and starch. But in simple terms, what I tell my patients, if it comes out of a packet, even ready meals, and it has 5 or more ingredients, this is an international definition now, it's ultra-processed. I would say cut it out, avoid it, minimize the consumption of it. It certainly shouldn't be half of your diet. Get it down as much as you can. But if, for example, let's say the whole British population now were to hear the message that, what I've advocated for is need to eat nutritious food, protect the NHS and save your own life as well. If they were to all do that, the whole population, just for a month, many people, up to 50% potentially, could send their type 2 diabetes into remission, could lose significant amounts of body fat, and would be in a much healthier state to deal with the fact that if they were to contract COVID-19 at some stage, then they're going to be in a much better position to deal with it, survive it, and get on with their life. And I also talk about this moving forward in the future, Stephen, because the likelihood is, and there are predictions that in the next decade, maybe 5 years' time, we may have another similar type of viral attack on, the whole world, essentially. our healthcare systems will be able to deal with it better because we'd have a healthier population. We therefore may not need a lockdown because we'll be able to deal with it, because the population is healthier, because the mortality rates would not be so high. And unfortunately, we've been sort of sleepwalking into this problem for a long time. I've been advocating and talking about this for over a decade. I spoke on BBC Newsnight about this almost 10 years ago, that really the junk food has infiltrated itself within the whole of the British diet that's become normalized, even in hospitals. Hospitals have become a branding opportunity for the junk food industry. Recent research revealed that 72% of food purchased in hospitals, Stephen, is unhealthy, is ultra-processed junk food, when actually diet-related disease is the major stress on the NHS. And more than 50% of NHS employees, unfortunately, are also overweight or obese. And this isn't about personal responsibility, unfortunately, Stephen. This is because our food environment has made these foods unavoidable. The food industry have profited from getting these foods which are highly addictive, that don't make you feel full, that drive appetite. So this has become a hormonal issue as well.
I wonder how many people have you lost in your last statement. I wonder how many people were with you, Aseem, until you started saying it's not about personal responsibility. Of course it is.
Well, I think personal responsibility has a role, Stephen, but I think let's just define that briefly. To exercise personal responsibility, you need two things. You need knowledge and you need choice. The problem is the knowledge has been, unfortunately, how should I put it, influenced or corrupted by commercial influence. A lot of, you've known this we've been talking about this for many years. But for example, I was one of the campaigners behind the, sugary drinks tax. One of the things I highlighted in my research, a lot of these foods people were buying that would be marketed as healthy, as low fat, were loaded with sugar and going to be more harmful for you. And then if you combine that with the fact that because these sorts of foods have become so prevalent and almost unavoidable, for many people, it's very difficult to even get access to healthy, nutritious food. Some parts of London, certain parts of the country are what we call fresh food deserts. There are takeaways every second shop. These are the things where government has to come in. So personal responsibility, of course, it has a role, Stephen, but actually the reason we've not combated it is because we haven't had policy changes that make sure, for example, why? I mean, just ask yourself this question. You're in hospital, you're sick. Why are you being served junk food? Why? I've had patients, and I'm talking to them after having a heart attack, who, about their lifestyle, are getting served a burger and chips. While, as part of, we're legitimizing these foods because we've been ignorant to the science around healthy eating, and because the food industry have unfortunately managed to get their products available to anyone, anywhere, at any time.
So if there is, and we haven't got to this stage, but if there is a surge to the extent that there are not enough ventilators, there's not enough equipment to serve the number of people in hospital, would you be putting obese people towards the back of the queue, given their statistical chance of survival compared to someone who's healthy?
Absolutely not, Stephen. No, absolutely not. Because as I said to you, I think, majority of these problems are not related to, because, as I said, majority of the population are overweight or obese. We haven't suddenly become all irresponsible. It's very difficult. I was a person myself, Stephen, that, thought I was being healthy, was very active, a sportsman. I was consuming, loads of sugar, 40 teaspoons of sugar, until I was aware of the science and the evidence around it. And I cut it out of my diet, and I lost a stone, and I was metabolically healthier. And I realized even myself, someone who's a doctor, who's thought, you'd think is relatively well educated, was completely deceived. If someone like me is completely deceived, what hope is there for the rest of the public? So, no,
I'm not talking about you doing that to blame or punish someone, but you're telling me that our life chances, if we're obese, are significantly affected by this. Why? What is fat doing to the body when we're trying to beat a virus like this? What's it doing?
It's a very good question, Stephen. I'm glad you raised it. So when you look at the data, certainly related to other respiratory viruses and pneumonia and flu, for example, there are two things going on. One is that if you have a poor diet, not just with obesity, but any excess body fat, essentially, or you're not eating the nutritious foods, then you have a chronic inflammation going on the body. In essence, mildly, your body is chronically inflamed, it's under stress, it's being attacked, it's being damaged. Okay, so this is what's going on, and over time, this is what leads to these other conditions, such as high blood pressure and type 2 diabetes, heart disease, even cancer and dementia has been linked to this. Excess body fat itself interferes with the immune response to infections. So not only does it cause what we call an exaggerated immune response, which results in what we call the acute respiratory distress syndrome, ARDS, is what kills people from COVID-19 and influenza, for example. But also what's interesting as well, if you're obese, and certainly in terms of flu data, and it's very likely coronavirus is the same, is that you carry the virus for longer, for 42% longer. Now, it's interesting. It's an observation. It's not a scientific study, but I noticed, of course, many members of the cabinet, even the chief medical officer, the chief executive of NHS England, the health secretary, all got COVID-19. They got the coronavirus, but they had mild symptoms and they were back to work pretty soon. Boris Johnson, unfortunately, did not. And thank God he survived and he came out of hospital, and we're all glad that he came through it well. But as a doctor, I observed the facts, and I've known, I used to be advisor to the London Food Board, and I've worked with and spoken to many senior advisors of Boris. And many years ago, one of them commented to me that they were very concerned about Boris's health. Despite the fact he was cycling everywhere, he was significantly overweight. And one of them said to me, Aseem, I'm concerned. He doesn't look well. When this happened, I straight away was very concerned because Boris has a high BMI. He may well be obese. He's certainly overweight. And it's interesting that he unfortunately managed to get more sick from COVID-19, but it fits with the rest of the evidence of what we know.
Well, it fits, but you'll be the first to say you can't draw any conclusion out of observing that from afar.
No, you can't. But when you look at that observation and then you look at all the data, and clearly, as we've already spoken about this, Stephen, that people with obesity under 50 are the highest risk of death by far, then, that does seem to make some sense. And of course, we're trying to also educate the public with taking some case studies or some simple observations and then using complex information to really give them a message, which is just really cut out the junk food. And it is affordable. It's harder because a lot of cheap stuff is heavily marketed. These cheap processed sugary foods are heavily marketed. But one of the examples I give to my patients is, an apple costs less than a chocolate bar.
And just remind me again what you said, Aseem, for those under 50, how much more likely are they to die from coronavirus if they're obese?
Well, I think that how much more likely hasn't been exactly determined for that specific group, but it's the biggest risk factor, more than high blood pressure, type 2 diabetes, and heart disease combined. It's emerged that if you're under 50, those people that are dying from COVID-19, obesity seems to be the biggest factor. But to answer your question more generally, if you have obesity or the related conditions of what we call the metabolic syndrome, which is all related to poor diet, such as type 2 diabetes, then the increased risk of death compared to someone that doesn't, who's otherwise metabolically healthy, is 10-fold higher, 10 times higher.
And how quickly can we do something about that? Can we turn it around?
The good news, Stephen, is, as I've been advising my patients, as I've done, with treated, scores of patients with these sorts of conditions over the years, is that within 21 days, you can see significant benefits. Some of my patients have reversed their type 2 diabetes. Can you believe it? Within 21 days of changing diet. These are people that have been on medications for years, and they're shocked. And most specifically in that group is you cut out the sugar and what I call the processed or the starchy carbohydrates. So your diet should be based on lots of whole foods such as vegetables, some whole fruits, oily fish, nuts, meat, dairy, eggs, cheese, that kind of stuff, the full fat kind of nutritious foods, but without the starch. So cutting out things like bread, pasta, rice, and potatoes.
And presumably exercise helps.
It does. But interestingly, I would say exercise has many benefits to health, but weight loss isn't one of the biggest. It's one of the smallest benefits is weight loss specifically. So I'm a avid, almost obsessive exerciser, but I do it for my general health and in a sense of well-being, my fitness. Of course, it's good for things like type 2 diabetes and blood pressure, but the biggest factor of all, Stephen, is diet. Now, when it comes to exercise, the best exercise you can do is the one that doesn't really cost anything, and that's actually just doing a brisk walk for 30 minutes 5 times a week. All the data on exercise in terms of cancer prevention, heart disease, type 2 diabetes, all that kind of stuff, it's actually just on the moderate activity. You don't have to overdo it. You don't necessarily need to join a gym. And of course, right now, people can't go to the gym. So what I say is get your 30 minutes in a day, and that is, you're really getting the best out of your exercise that you can get, but really sort the diet out.
BBC Sounds, music, radio, podcasts.
Coronavirus is here, it's real.
Right now on BBC Sounds, you can listen to the Coronavirus Newscast.
Really big changes to how the country's going to operate to try and stop the spread of the virus.
Keeping you up to date with the coronavirus outbreak.
We're going to be on every day, doing our best to keep you entertained a bit and informed a lot.
Hear the latest episode on BBC Sounds.